Good evening and welcome back to the Sheila Exchange. I know we've taken a break for a while because we wanted to rethink how this platform functions. And I made the decision that we're going to use it as a platform to exchange any kind of information. So you're not necessarily going to be seeing me every week on this platform. Occasionally, I might invite a guest speaker to conduct an interview and a guest presenter to conduct an interview with someone of interest. So if you feel that you'd like to be that presenter or you feel that you have a great story to tell, do get in touch with us and we can talk. So welcome back to the Sheila Exchange once again. It's 5:30 p.m. Friday evening in Kuala Lumpur. And today I have a special presenter, a guest presenter, who will be speaking to her own guest on the topic, close encounters of the worst kind. So I'm going to introduce you to our guest presenter today, who is Alleena Abdullah. Let me tell you a little bit about Alleena. Alleena has a postgraduate diploma in international hotel and tourism management from the south of France and an MBA from IMHI, Cornell University in international hospitality management at ESSEC Business School of Paris. She's lived overseas for about 25 years before returning to Malaysia. Now, Alleena has worked on numerous international and local corporations. She's worked with them across industries and has extensive hands-on operational and strategic knowledge in the area of brand, marketing, and sales management in retail and B2B markets. And she can talk. That's why we've invited her to be a presenter. Now, lately, Alleena has moved into the realm of training, spurred by her love for training entrepreneurs. And she also set up her own social enterprise, Yellow Tree Malaysia. You can see the logo at the back there, with the intent of building strong brand and business foundations for micro businesses and entrepreneurs. So if you want to get any help on branding, Alleena is the woman for you. She's also the founding partner of Pathway, a new brand specializing in innovation, branding, and business development, and is an associate consultant with Human Equation. Wow, I feel as if she's going to be the guest, and I've done this heck of a lot of introduction. And so now I'm going to hand over the floor, the platform, the Zoom platform, to Alleena Abdullah. Take it away, Alleena.
Thank you very much, Sheila. That was really, what a great welcome. It's really a pleasure and honor to be here. And today we are going to talk about close encounters. And thank you everybody for being here. I hope everyone is able to wind down on this Friday evening. It has been an extremely difficult week for many of us. And today, let's understand a little bit more about what some Malaysians are going through that is more closely related to COVID-19. And we have a special guest, and I'm honored to present her to you today, Joanna Ambrose. Welcome, Joanna, on the Sheila Exchange. And before we start chatting, Joanna, if you don't mind, I'm just going to do exactly what Sheila did, is introduce you. Ladies and gentlemen out there, she is amazing. She's a passionate lady who loves writing, coaching, and she's a pro at communications, if you know Joanna. And if you follow her on TikTok, social media, she is one hilarious lady, but also champions some very serious topics that others prefer to ignore. And it's nice to see someone in Malaysia who's very, very independent about issues and certain things that the public feels a bit uncomfortable to talk about, such as mental health. She has a blog, Thorns and Roses, and she writes about issues that are close to her heart, mental health, as I've mentioned. So at such a young age, Joanna, you also coach and train other people to take charge of their life and transform their lives. And she uses NLP as a tool, which is really great for someone so young. And don't let the TikTok fool you, because Joanna also has an honors degree in psychology, and she is she's certified in applied behavioral analysis therapy. And you have so many different experiences in all areas, such as PR and digital content creation, Joanna. It's really, really interesting to see a guest with so many things at such a young age. And you began your career as a childhood educator and also served part-time as an autism therapist. Joanna, thanks for being here today. We're here to talk about narrowing experiences, right? Experiences and encounters. And you recently had a harrowing experience. Can you tell us a little bit more about it, Joanna?
Yeah, sure. But wow, what an introduction. It feels a bit weird to have my resume kind of listed out before me. I never realized I achieved so much. Thanks for that.
No
Yeah,
worries.
recently I did have kind of a health scare, I suppose. And it's funny because in that moment when it was happening, I don't think I realized just how scary it was until it was the people around me who started telling me, we were worried there for a minute. So basically what happened was I had been sick for about 3 to 4 days, and I was pretty certain it was a stomach bug, mostly because I was having symptoms like throwing up. I did have symptoms like fever, chills, and all of that. And for about 4 days, I couldn't eat anything. I couldn't keep anything down. I actually did go to a clinic to even get a jab for this stomach bug, which is what I thought it was, and which ended up making me feel a little bit better. But when it started getting worse, and of course, in this time and age, I feel like whenever we have symptoms, like even if it's just a sneeze or a cough, immediately the mind goes to COVID, right? I hope it's
Right.
not COVID. I hope it's not COVID. And so even as I say, like I was pretty sure it was a stomach bug just because there was a lot of throwing up and a lot of gastric things going on. And I do have a history of gastric problems. There was a small part of me that was still like, okay, Googling COVID symptoms just to see which ones of them do I have, which ones of them are like not matching with the COVID symptoms, right? But even then, there was a small part of me that was like, okay, just be a bit. And sorry, I was just a bit distracted there.
That's
And in
fine.
the 4 days that I was sick, I actually was not staying at home at that point in time. But because COVID was there in the back of my mind, even though, again, like I said, I thought stomach infection, when I came home, I was very strict because I live with two people who are over the age of 60. So I came in through a separate entrance, quarantined myself in my room. I refused to go out. I had to have food kind of placed outside my door by somebody wearing a mask, and made sure I wouldn't open the door until they had walked off because I had that fear, right? And it's interesting because I guess this is probably how we end up like convincing ourselves that it's not COVID. And then unfortunately, in some circumstances, it might end up being that. In my situation, I'm very thankful that it wasn't. When I did go to the hospital, I ended up being admitted into the emergency room. And the doctors did a scan, and they initially did a scan of my stomach because that's the part where it was hurting and I was complaining of. And just by chance, the technicians who were doing the scan, the CT scan on my upper abdomen, they noticed that there were irregularities in my lungs in part of the scan. And so they kind of insisted that I have to do another scan. And when that kind of came back, the doctors were a bit worried that it might be COVID. And so I went through a moment of uncertainty. I had to do a COVID test, also because I was having breathing difficulties. That was one of the symptoms, apart from fevers and chills, right? And I started wheezing, and it got really bad while I was in the hospital, to a point where when they did the scan, the CT scan of my lungs, it showed that there's some kind of infection there. So I was waiting for the results. Thankfully, it turned out to not be COVID, but it did get pretty severe because there was some worry and concern that I would go into respiratory failure. I was, while in the emergency room, I was actually coughing out blood. And so that was the symptom that actually made me eventually go to the hospital and to get myself checked out, because that's also one of the symptoms of COVID. And that was when, okay, fear, anxiety started setting in. Like, don't play around, go to the hospital now, because you cannot risk anyone in your house getting infected if it is COVID, right?
Right. So, I mean, you talk a little bit about anxiety. Right now in Malaysia, I think every single household, every single individual, at whatever age you're able to feel anxiety, are feeling that right now. And those moments, I mean, days or hours, what was that like? And how did you manage it? Was it even in your mind to manage it yourself?
I mean, I am lucky in the sense that I have for a long time been learning how to manage anxiety. You know, have had access to tools and to learning how to sort of manage these own feelings that tend to creep up. So in that situation, I guess I was pretty okay. But I think the real anxiety and the fear is just because it's COVID, right? It's that fear
Right.
of it's not just me contracting it, it's what if I pass it on to somebody else? You know, I
Right.
think this was a fear that also rose initially when COVID first came around and became very serious. It was the realization it's actually not about me. If anything happens to me, it's fine. But if something happens to somebody else because I was not careful, that is the fear that I think that would be a lot more difficult to live with.
Right.
That, you know, knowing that I probably could have done something to prevent it. You know, I could have been more careful perhaps. So that's why in this situation, when I did start thinking, okay, what if it's COVID? I was very like strict in my house and I was like, Mom, no, you are not coming near me. I'm going to stay upstairs. You guys stay downstairs. Nobody comes into my room. None of that. Yeah.
So what kind of you mentioned a few tools and to manage anxiety. For those listeners out there, what would you recommend, from your experience? And of course, you also have that background to validate it, that people can use.
Yeah. So one of the things that for me, breathing exercises is one main thing to manage anxiety because one thing with my type of anxiety, because everybody's anxiety comes in different shapes and forms, right?
That's right.
I have had a tendency to kind of go into like I cannot breathe sort of mode. So breathing exercises is always my first tip. It's that mentally counting down from 10 to 1, and at the same time, deep breathing like 5 times at least, if not 10 to kind of because that moment of taking time to like really breathe in air and let it out, that's a sort of a calming activity as well. So that's one of the things. The other thing is also to sit down and kind of have this conversation in my head. So a lot of my anxiety is managed through having the conversations with myself, but also it takes time to like learn how to have those conversations with yourself because a lot of people can be very harsh with themselves. So it's also with that mindfulness of asking yourself the right questions to kind of understand where is the anxiety coming from, you know, what is actually the root cause of it, and then figuring out, okay, so what is it I can do to address this situation that is causing the anxiety.
Wow, I love that speaking to yourself and being kinder to what you say in your head so that you have a very positive mental attitude. Absolutely love it. Now, let's talk a little bit about the emergency room. Even for me, I mean, the word emergency room really can freak me out. And I can't imagine at this point in time what it's like to be in any emergency room. And I would presume you didn't have all the people you wanted around you. What was that experience like?
So okay, it was actually quite interesting. So first of all, because the moment I thought, okay, this might be COVID, because I woke up in the morning and when I was coughing, there were like streaks of blood when I coughed out. So I was like, okay, don't take any chances. You got to go to the hospital now. So I got up, I drove myself. In all honesty, I can't really remember how I managed to do that. By the time I got to the hospital, it was then a decision. I thought, okay, because this particular hospital, it was Thompson Hospital, they had a COVID testing center. So I was thinking, should I just go there first? And when I went there, I discovered they don't do the rapid testing unless you're being admitted or you're in the emergency room. And it would take 24 hours. And at that point in time, I was also not feeling good. So I thought, okay, maybe I should go actually see a doctor since I'm already here in the hospital. Because if it's not COVID also, then I need to see a specialist, probably a gastro specialist, because I thought it was a stomach bug, right? When I went through the entrance of the hospital, the concierge staff was like, okay, yes, miss, where do you want to go? They're doing their job to find out why you're there at the hospital, whether it's valid or not, right? And they looked at me and they said, you don't look very good. Would you prefer instead to go to the emergency room? And we can, provide you with whatever help that you need immediately. And honestly, I was at a point, I was in no state to really argue with anybody or to kind of contradict anybody. So I just went with it. They got me a wheelchair, they put me in, and they started checking my vitals and all of that. Initially, to the hospital's credit, it was not like, even though the symptoms were there, I hadn't had any contact with anybody previously, any positive cases or anything like that, right? So they did the questioning techniques and all that before they to kind of ascertain if it was a risk, if it was a COVID risk. And eventually they brought me into the emergency room and they did a couple of tests. The doctor started with blood tests because he suspected I was actually having dengue, because the symptoms are very similar as well. And he also ordered a CT scan. So dengue test came back, it was negative. So I was there in the emergency room. In fact, I was actually in the emergency room for almost 24 hours. I had gone at 11 in the morning, and by 11 o'clock at night, I was still there. And things had kind of escalated by that point. So what happened was, in between the scans and all of that, I started from not only coughing up blood, it started becoming more intense. I was also throwing up more frequently, and I started having the breathing difficulty at that point in time. So that happened, and I told my doctor the moment I started feeling that heaviness in my chest, because I didn't feel that initially. It wasn't a symptom that I had been feeling the whole time. But when I did immediately start feeling it, and I think after the CT scan where the technicians had said, I think we need to send her for a lung scan because we saw some irregularities in the scan of her upper abdomen, that was the moment where my doctor was like, okay, we're going to send you in for a COVID test. So I had to do the rapid test and all of that. And I had also gone for the CT scan. And when the CT scan came back, the doctor actually saw that basically my lungs were not in a good shape. In my appointments after that, my doctors told me that at that point in time, my infection rate, so basically I had a lung infection, but thankfully it wasn't COVID, but it was kind of similar, I suppose, because, similar body part being affected, right? My infection rate was at 200. Which is like way off the charts. And the doctors had told me they were surprised at how I came in and I was still standing, because at that point in time, the scans had also showed that my lungs were filling with water and they were also bleeding. And that's why I was coughing up blood. And so at some point in the emergency room, when all of this was happening, I had this moment where I started really not being able to breathe. So imagine I'm like having anxiety a little bit from like throwing up blood and coughing out blood. And I'm already cold and I'm worried about what's going on. And then I'm trying to do my breathing exercises to like calm myself down. And then I can't breathe. So that was what was happening in that moment. And it was a bit of like a mental like twist going on in my head, because I'm trying to breathe to calm myself down and yet I cannot do it. So it was at that point I actually really started struggling with my breathing, and then my body started like shivering uncontrollably, and it was a moment of completely not having any control over my body whatsoever. And it was actually pretty terrifying, I think, out of the whole experience, because after that I ended up spending about 4 days in the ICU, and I was in the hospital for a week in total while the doctors were able to, administer medication for the infection. I even had to go through a lung biopsy as well. But it's, for me, the reason I say it was an interesting experience, because the moment that was the most terrifying was being in that emergency room, not being able to breathe and not having control over my body. Right. And so what happened after that was when I went into that state of, I guess, I don't know what state it was called, but I was in shock. My body was in shock. I couldn't breathe. I was uncontrollably shaking. They had to kind of take me to the resuscitation area in the emergency room and put high pressure oxygen on me. And that was the only thing. Then once I was able to breathe, it's like the rest of my body calmed down. The shivering and everything stopped, thankfully. So, and then after that, the concern then was, okay, so because I had this episode of, not being able to breathe at all, the doctors were like, okay, so we can't just admit her into a normal ward. We need to admit her into the ICU, right? Because there is a chance that she could go into respiratory failure. That was the worry, because at that point in time, they had gotten the scans back, everything, and it had shown that my lungs were in quite a bad state, but they didn't know what it was. They couldn't tell just from the scans, and that's why the biopsy had to be done later on. But yeah, so there were no ICU beds for me to go into in that hospital at that point in time. And the reason I needed the ICU is because they needed a ventilator just in case I went into respiratory failure, because then they could force the breathing tube into me, rather than the high pressure oxygen, because that still requires you to have some form of consciousness or like control over your breathing at that point in time, right? If I did end up unconscious, that's when they would need the ventilator. But there were no ICUs available in the hospital, or at any hospital in the Klang Valley. I think this happened about a month ago, and this was during a week where, if you look at the news reports had come out to announce that the all the ICU beds in Malaysia were basically at full capacity.
Right, right. I mean, I think one of the things that people right now, we read about a lot about this situation in newspapers or on the news. And when you were going through all that, tell us a little bit about what was going on around you when, a doctor had to tell you, like, you're going to have to be in ICU and on a ventilator, but, we're not sure if there's going to be one available. And what does it feel like? Because I think we read about it, but you were in that situation.
Yeah, I think the first thing is just the fact that I was not so worried anymore because the COVID test had come back and it was negative. So once that had come back, I was like, okay, it's not COVID. It's not going to be life-threatening. You know what I mean?
Yeah.
But obviously that wasn't totally the case, because the doctor did tell my mom that, this could be life-threatening because I was coughing up blood. It was my lungs. I couldn't breathe. They needed a ventilator and all that.
Right.
And to be honest, at that point in time, because I was a bit in and out of like sleep and consciousness while I was in the emergency room, I wasn't really communicating with the doctors much. I had my mom there who was with me, and she was communicating with the doctors. And then I think she was filtering some of the information that I knew as well. So I think that's what led me to not feel so terrified in that moment. What did scare me was the fact that, I had a couple of my family members who were within the area who came to see me. And then I was like, oh, okay, people are here. Am I okay? And then the doctor tells me, so this is what we suspect. It could be bronchial pneumonia. It could be thoracic endometriosis, which was a new thing for me, because I didn't even know endometriosis, which is a female reproductive health condition, can actually travel to your lungs, and that's what's causing the bleeding. So I was mostly listening to the conversations that were happening around me, and I heard some of these conversations about how, okay, we need to get her into an ICU, but this hospital doesn't have one. And so I knew, like, my family got the hospital to call any hospital within the area to just find out, okay, do y'all have an ICU bed we need a ventilator and all of that. And every single hospital was full. They were like, nope, we're full up. And it was because they were full of COVID patients.
Yes.
This is what our country has been going through. Our healthcare system has been going through as well. So it's not a surprise at all. And the hospitals that did have an available ICU bed and did have a ventilator did not want to take my case. One, I suppose, because it was too late at night. And two, probably because they weren't sure what was wrong with me at that point in time. And as a hospital, maybe you're thinking, I don't want to take this risk.
Right. Yeah, I mean, you mentioned a little bits about family, and you can actually sense, that I can feel that you are very thankful. Yeah, that there was someone to filter the information, talk to the doctors, and I mean, I don't think any of us can really imagine what it's like for people who don't have family around them. Right?
Absolutely. I'm personally just thinking about COVID patients who are in the hospital who can't have their families visit them at that point in time. I was very thankful that I had my family there to be able to, as I said, to filter out certain things, but also it was comfort, right? So I can only imagine what it must be like to be in that situation and not have anybody be able to see you. And on top of that, the burden really of that comfort and making sure that you're feeling okay, it really falls on the nurses and the doctors who are taking care of you at that point in time.
Do you think that people need to go through this experience to understand that? Or did you actually think about it even before this close encounter happened?
I will say that because I do live with a lot of high-risk people, my mom, my grandmother, and then my sister also has a baby, I will say that I've always been kind of careful, but I don't think I had this perspective of, what is going on in the hospitals until I was really put in that position where I needed an ICU bed and there was not one available for me.
Right.
That I think it was quite scary for a second there to think that, okay, no hospital is able to take me, so what's going to happen to me? You know what I mean?
Yeah, I mean, and we see a lot of Malaysians, and great to the ones who have been very careful and have been advocating safety, SOPs, etc. What would you do to get through to the people even now who are still extraordinarily stubborn, invincible, you name it, because we saw this happen. Yeah, MCO, movement control order number one, number two. Even after that, people were drinking out there, without their masks on. I mean, we've seen them. What could you do as someone who's been through this? Convince people at least.
Personally, for me, I just want to say you do not want to be in the situation that I was in before you start thinking about it. Now in itself, we need to be really, like for me, this was a big wake up call that I need to be careful, that I need to not take it for granted, because look, at the end of the day, our hospitals and all, they're full of people who are suffering from COVID right now. And so, but that doesn't mean that other health issues don't happen as well, that they don't go on. Right. But I need to be doing what I can, all the more to prevent this situation from happening, to prevent there being a need for me to go to the hospital and get treatment at a time when the focus really is on COVID and what's going on there, because COVID is life-threatening. People are dying from it. You know what I mean? And so it was a real wake-up call to not take it so lightly, to, sort of bring me back on track and remind me like, hey, don't take it for granted. Don't, get complacent about it, because it is a real virus. It is a thing that's affecting so many people out there. And I was lucky that what I had was not COVID, but imagine if it had been, we could be having a whole different conversation.
Understand. And now that you've been through this ordeal, it's just really very, very scary. And I'm sure you're going to be extraordinarily careful after this. And, in the Asian culture, we're very trusting. And when we meet each other, families, and I've also heard stories where people were just like, oh gosh, I have to leave my mask off, because then someone might feel that, there's something wrong with them, right? There's this issue of trust. How would you manage that after this?
Honestly, I will say at this point, trust is questionable a little bit, because this is our health that we're talking about. I'll give you an example that even after what happened when I came home. So for me, what happened was that even after I came home from the hospital, the doctor told me, you are high risk now. You are to be quarantined at home, no visitors, no going out, no exposure, nothing, because if you get COVID now, that's it. Your body is not strong enough to fight it. And so for me, I kind of had to go through that. We had like neighbors who lived in the same building coming and visiting us to, at that point in time, to give us food and things like that. And I had my mask on the whole time. And even at times where, now if I'm, let's say, walking out of my condo to go downstairs to get a package or something, I double mask now. I even got my face shield just for added measure, because again, like I said, this is your health. You can, there's no more taking it for granted. I'm not saying there's no room for trust, but you got to be smart about it as well, because you don't know who people have been exposed to. There's no guarantees here. It's not like everywhere you're going and swabbing people and getting back negative for COVID test. You get what I mean? It's a different situation if you have that, for sure. Even Absolutely. With, I think, we have to be super careful, because there's no 100% guarantee. Although the vaccines protect us, like some people who you take the first shot, yes, it does sort of, it works in your body already to protect you to a certain extent. Studies have shown that already, but wait until you get your second shot a bit also before you kind of trust. You know what I mean?
That's right.
That's just my perspective of it.
Right. We've been talking about, vaccines. I think it's been a hot topic for the past 2 weeks or 3 weeks. Are you allowed to take the vaccine, Joanna?
So at the moment, I actually don't know if I'm allowed to take the vaccine, because based on what I read online from articles and journals and stuff, they have said if you've had any kind of infection, you're not allowed to, you can't you can't go and take the vaccine. So I'm actually waiting for my follow-up doctor's appointment, where I'm going to have to do a blood test and a scan and to get the green light from my doctor. Because as I mentioned, they mentioned that I'm high risk. So I wouldn't at this point make any kind of decision. So I didn't even sign up for the vaccine the last time the registrations had opened, just because I didn't want to take a place away from somebody else if I wasn't 100% sure that I can take the vaccine.
Right. So when will you decide that?
I guess I will find out from my doctor next week when I get back from my appointment. But it's been, I've been experiencing a bit of FOMO, just seeing everybody. FOMO means fear of missing out, by the way, for those who don't know. Because I'm seeing everybody on my social media with their big AstraZeneca sign saying I've been vaccinated, and I'm like, guys, I want to be vaccinated too, especially now because there is that fear that, okay, I'm high risk now. I literally have not stepped out of my house even before this total lockdown started. So low key, I was actually kind of glad, like, hey, I'm not the only one who has to be stuck at home right now. Misery found some company in this instance.
I mean, as I was introducing you to everybody, the audience, and you're a great communicator. It's your job, digital content creation. This experience, are you going to translate it either on your blog or on your TikTok even? I mean, I've seen a few. Is it something that you'd like to do moving forward, at least in the next few months, to create some form of awareness, Joanna?
I mean, at some point, yes, I've actually started writing about this experience, journaling a bit about it, because since it happened, there have been a lot of revelations that, have sort of passed through and that I've been sort of marinating on, a lot of realizations about my health and about my life and about the whole situation that unfolded, because it is scary to go through, and this is the thing, I feel like it's a bit dramatic to look back on it and be like, oh yeah, it was a close encounter. It was like, a life-threatening situation. I personally, in my mind, don't really look at it as it was a life-threatening situation, but that's not what the doctors say. And when I came out of the hospital, everyone, my family, they were all telling me, we were actually really scared we were going to lose you. So I guess respiratory failure is a serious thing, It didn't occur to me until I had come home. And then I started processing everybody else's sort of reactions to how scary the situation was. Right. And so since then, yeah, a lot of realizations have sort of been coming to me, just based on in health in general, especially. So that's where, that's where the lessons like, trust this one thing, but in this situation, you can trust a person, but you can't trust COVID. COVID it doesn't discern against people that you trust even, it's just going to attack anybody. So yeah.
I mean, you're looking great. Yeah, you're smiling and you've got a lot of energy, and I'm sure that's to do with the recovering period that you've since coming back from the hospital. What would you recommend to people out there who are listening in on how to take care of yourself, not just mentally but also physically?
Yeah, I think first of all, the mental aspect of it is really so important. I think especially considering the fact that we're on total lockdown, everybody's kind of stuck at home. We all need to be doing the things that like mentally is going to keep us strong and resilient. One of the things I advocate for a lot is daily affirmations, just constantly being mindful of the language that you're speaking to yourself and also feeding yourself positive things. For me, in terms of the recovery, for example, there was one day where my mom had sent a message because someone had asked how I was, and my mom had sent a message saying something like, oh, she's not recovered yet or something like that. And I kind of jumped in. I was like, no, I'm recovering and getting stronger. That even that form of affirmations, like, because your body listens to the things that you're saying,
right.
Your body, like every single thought that you have, it goes through neurotransmitters in your body. And like for me to lift up a glass, that message is being sent from my brain to my hand, and it's being done at the speed of light. You know what I mean? But that doesn't mean that that message is not going throughout my whole body. So whenever you have a thought, a positive one or a negative one, it's actually being communicated towards your whole being. So that's where I believe in positive affirmations a lot, to, wake up and tell yourself, I'm strong, I'm healthy, I'm bold. Anything positive, it's important for your brain to be able to hear it and to process it. So the mental resilience is one thing, and also an attitude of gratitude takes you a long way. So it's the waking up every day and just thinking of 3 different things that I'm grateful for to build that mental resilience. But as far as physical health goes, I mean, I'm not a doctor of any kind to be giving anybody any advice, but I suppose
Right.
take your health seriously. Don't take it for granted. The moment you have like even if it's a small, heaviness in your chest or a cough or something, go and don't kind of sit there and think, oh yeah, I'm going to be fine. Self-medicating is probably the worst thing anybody can do right now.
That's right.
I think a lot of us sometimes have a habit of doing that. We'll just like, oh yeah, I'll take a Panadol and it'll make everything fine. But sometimes you never know. It really could be a serious issue. In my case, if I hadn't gone to the hospital at the time that I did, who knows what could have happened later on. I could have had that spell of uncontrollable shivering and not being able to breathe while I was at home if I had been stubborn about going to the hospital. And if that had happened at home, nobody would have been able to do anything to help me. So it really is just pay attention to your body, pay attention to the signs that your body's telling you something's not right.
Right. I mean, just to, also reflect a little bit for the past week, and I started this interview saying that it's been a very angry week, for a lot of people, and we understand why, the challenges with this major lockdown, and we do see a lot of negativity happening as well. Whichever chat group you're with, or if you're talking to people on the phone, etc. And with all these learnings that you have, and you're so positive, and I believe that's one of the main reasons why you can sit here smiling and talking about this in such a great way. How can positive affirmations, or what would you recommend to people right now who are bombarded with so much anger everywhere from your WhatsApp? I mean, if you're seeing WhatsApp for 100 times a day, it's bound to do something to you, like you said, if you talk to yourself, if you hear such things.
I've actually had somebody ask me this question after I came out from the hospital. They're like, how have you gone through what you've gone through? And you're so positive about it. I wish I had like a more concrete answer, except for the fact that honestly, it's mindfulness of the thoughts that go in the head. And 2, it really is a choice. It's a choice whether you want to look at things from a negative perspective versus a positive one, right? But then again, I mean, I feel like the anger is very different. The anger that we go through, it really depends, because sometimes anger fuels us and sometimes anger is a good thing as well.
Yeah,
so
right.
It really is that determination to decide, okay, instead of focusing on the problem, what am I going to do about it? That mindset. And that, again, talking to yourself, having the conversations with yourself internally to understand where the emotions are coming from, that's a really big part of it. That's a really important part of it as well, because for me, my perspective that I've learned is that really you do have a choice in the things you choose to think. You have a choice in the things you choose to pay attention to, in what you choose to take on. If you read something negative, it's a choice to sit there and take it on and be affected by it. You know what I mean? Rather than sitting and saying, okay, that's horrible. Is there anything I can do about this horrible news? Yeah, I mean, in this, but again, I go back and say, I understand the anger as well, that, a lot of us, and the frustration that we're all feeling, because in these times, there are not necessarily a lot of things that we can do. So it goes back to then just really, again, having the conversations with yourself, to talk to yourself and be mindful of the thoughts that are going through, to find a way to focus on the positive. It's not easy at all, but it is possible.
Yeah. For sure. But, thank you so much, for sharing what you went through during this really difficult time all over the world. And, I'm in awe and admiration that you have made it through such a difficult period. And I think, like you rightly said, positivity, speaking kindly to yourself, making that choice to say, yes, I'm going to take that in, or I'm just going to manage it differently. Thank you for telling all of us, like, what can we do? We have a choice to move forward, and just be as chirpy as you are after going through all those horrifying moments that you shared with us. Thank you very much, Joanna.
Thank you so much for having me.
No problem. But I just want to thank everybody, including those who've attended this session, and I hope you've learned something today with Joanna. And thank you, Sheila, for allowing me to interview Joanna. Hope you captured something to take on this weekend, the next week, and until the end of the year, until we all get through this together with positivity and making that choice to make a good impact and to be good and kind to yourself. So until the next time, I see everybody.
Stay safe. Bye.
Stay safe. Bye, everyone.